And welcome back to Sunday Square Off. We're with former Arizona Health Services Director Will Humble. And Will, when we last spoke in September, bars were reopening, restaurants were reopening, and you had a plan, suggested a way to make sure they stayed within the rules. What was that?
Yeah, so what I thought we needed, and I still think we needed, it's not September anymore, it's November, was a proactive, rigorous enforcement system to ensure that the bars, restaurants, and nightclubs were following the mitigation measures that they agreed to when they left that pause that the governor made at the end of June. That a reactive complaint-driven system isn't adequate. You need to enlist your food safety workforce, or perhaps even the National Guard for that matter, to go out to bars, restaurants, and nightclubs and catch those people that are ignoring the mitigation measures. But that had to have happened a long time ago for that to have an effect now. At this point, I think, a combination of both a statewide face covering mandate that was enforceable on businesses, not individuals, like the Smoke Free Arizona Act. You got to go after businesses, not individual people. That could have an effect in combination with shutting the bars again and having the restaurants go back to just takeout service. It was avoidable if we had done a good job with enforcement at the beginning, but because we didn't, I think we're facing that decision now. No, do I think the governor's going to do that? Not now, but when we reach crisis standards of care in probably about December 18th, you bet he'll do it.
So I want to understand, you think the governor should shut down the bars again? Because I from reading what you've written, I thought you were thought there would be a compliance regimen.
That's if you had time for the compliance system to work. I mean, if you had rigorous compliance and enforcement back when we talked last time in September and had a proactive system, you could have, in all likelihood, prevented another hospital crisis and prevented the necessity of shutting bars again. But at this point, and especially after reading the ASU modeling team's report that came out yesterday, I mean, you can read it, Bram. It paints a dire picture and immediate interventions are needed now. Now, they do say within that report, they modeled it out, and without Thanksgiving, let's say Thanksgiving didn't exist, they say the hospital crisis happens about January 15th. But when you add Thanksgiving in, because it's a reality, it's going to happen, that moves the crisis up to between December 18th and the 24th.
You've been doing this kind of work your entire career. What have you learned about people and about how to deal with them in pandemics?
Well, I will say I've learned, not something I learned, I'm old enough to have learned this a long time ago, but there's certain people, in our case, elected officials, that don't seem to be able to learn from their own mistakes.
All right. On that note, I'm afraid Will Humble, thanks so much for joining us, and we wish you a happy holiday. Take care.